Thank you, Brooke. More than 800 cases of gastrointestinal illness have come across the more than half the United States. Cyclosporiasis making health headlines as the grand total of cases continues to climb. The illness reported to cause diarrhea. The Centers for Disease Control and Prevention reportedly investigating more than 1,500 likely new cases. News Channel 11's Anderson Jones spoke to local health officials on the illness and is standing by with what she learned. Good evening, Anderson.
Hey Casey, a parasite called Cyclospora has been infecting food and water across the U.S., specifically impacting raspberries and leafy greens. Dr. David Kirschke, medical director for the Northeast Regional Health Office, suggests what you can do to stay safe.
Ways to make it safer is to wash all your fruits and vegetables. You can eat frozen vegetables are safer. Anything cooked is more safe. Some people suggest eating local produce.
The risk comes from food contaminated by coming in contact with feces that contains the parasite. This creates what is called cyclosporiasis, an illness that affects one's intestines. Symptoms of this infection include watery diarrhea, stomach cramps, and fatigue. 11 to 30 cases have been reported by the Center of Disease Control and Prevention in both Tennessee and Virginia, but health department leaders believe it could be underreported.
You know, the patient has to go to the doctor, do a stool sample, have that tested positive for Cyclospora, and then the healthcare practitioners will report it to the health department. People don't always do that, so there may be more cases in the community than we know about currently.
Holston Medical Group primary care sports medicine physician Dr. Kevin Metzger shares the severity of the infection.
The unique thing about this disease is that it takes a while to develop symptoms even after you get exposed. It could be from 2 days to a few weeks after you eat that thing before you develop symptoms. As if this is confirmed, there's an antibiotic that we routinely use that can treat this effectively. The hard part is it's somewhat difficult to test for. There's some special stools testing we can do, but it's not always perfectly accurate.
As for now, the cause of why this is happening has not been determined. Casey, back to you.